then just keep trying to one thing we want you to take this is a few minutes just to round up and then we finish this discussion because acceleration is very important. So in that case then can we move, we are going to make sense. I think we are going to do this in order. Is the second.
We will be starting this meeting in 2 minutes. We are just giving those that may, be trying to log in a few moments, but we'll be recording the meeting as well. So definitely 2 minutes from now, we will start the meeting. And those that fail to make it, we'll share the recording with them. Thank you everyone for being on time. Also, we have your microphones muted until question time so that we have a few disturbances. So, yeah, I will just be talking alone until question and answer time.
Yeah.
All right. So once more, good afternoon, everyone. We will now be able to start our meeting. This call is being hosted by the Vaka Health Foundation so that we can be able to share an exciting call for startups that may want some seed funding to be able to participate in the Vaka mission, which is really to lift, health outcomes for the citizens of Africa. My name is Admojo Kiro, and I'm the Digital Health and Innovation Lead for the Vaka Health Foundation. I'm based in Zimbabwe, and some of my colleagues are based, in some parts of Africa and Australia as well. I will talk briefly about them in a slide during this meeting. The first 30 minutes of this meeting is going to be dedicated to just describing what the Vaka Health Foundation does, what is the Startup Accelerator program all about, what are we trying to achieve, and how are we going to achieve that. Then the rest of the 30 minutes in this hour will be dedicated to really getting, some questions from the floor, which can help everyone else understand more and also answer that specific registrant who will be asking. So now, without much further ado, I will start, on the first, slide. So I didn't really do well in terms of setting up my meeting. So I will be switching to admit those people that may be late, and then going back to the PowerPoint slide. In a few words, the Vaka Health Foundation intends to lift health outcomes in Africa, especially, but even in some parts of the world like Southeast Asia, and where we get, an opportunity to be able to work. With that in mind, with that specifically in mind, um, anyway, before I proceed to avoid this, let me do this. Sorry about that, but I'm trying to do something that we have less disturbances. Let me just share the appropriate window. Yeah, so there we go. So the Vaka Health Foundation, in a few words, intends to lift health outcomes. So we do that by partnering mostly with nurses, because nurses are at the center of primary health care in Zimbabwe and even in the rest of Africa. So we want to increase the efficiency and effectiveness of training of nurses and midwives wherever and whenever they meet. We are so grateful that we have really accomplished nurse leaders like Dr. Dozo, who is here on the call, and actually she was the first one to join. And she's someone that we have worked with over a long time, but who remains dedicated to each and every initiative that supports midwives particularly, but nurses in general. So it's all about empowerment. It's all about inclusiveness. Why, Vaka Health Foundation? What's in our name? Vaka is something like Vaka. It's Kiswahili, but also, Shona, which means build, develop, or to be awake, or to watch, or to guard. So we derive a lot of, emotions and attachments with our name, and everything that we try to do centers around building, around developing. So this reflects our values and ethos to build better healthcare in Africa. We are online via our website, vakahealthfoundation.org, and we are known as a social enterprise, which means really we are not for profit, but we use some business concepts to ensure that there's sustainability. We are on a vision to improve health outcomes in Africa, and we use internet or technology to we leverage internet and technology to be able to improve these health outcomes. So we are using scalable mobile technology to solve healthcare challenges. We are targeting around 450,000 frontline nurses and midwives in East and Southern Africa to address the chronic underinvestment in healthcare training, education, to promote preventive health through proactive screening, and to promote nurses' retention through economic empowerment. Our story started in Zimbabwe just before the COVID-19 pandemic. Our goal was to, build a platform that would make clinical distance support and continuing education, available. And we worked, with people like Dr. Dozo to make this possible, as I said earlier. Then COVID-19 accelerated the adoption of technologies, and over the last 3 years, we have developed, 1,000,000 units. That is, CPD activities that have been performed by nurses, within Zimbabwe. Every year, they do an average of 15 CPD activities to 18, and multiply that, by over 25,000 nurses. That's, over 3 years. That's how we go to the 1,000,000 units. You may just wonder where that arithmetic, is coming from. But we have now broadened our vision to beyond, CPD. We realize there's a need for upskilling through micro-credentialing, advanced nurse training through fellowships, and these are programs which are being spearheaded by Hexacon with their education committee, which includes people like Dr. Dozo. I keep making reference to it because she has done a lot for nurses even even as we speak. Economic empowerment is one area that we are looking at, because from a WHO report and World Bank, reports, it was highlighted that the other reason why we were having a high flight risk from Africa was because, nurses will be seeking greener pastures. So there is need to empower, nurses so that they can be retained and empower them strategically. Our team at Vaka Health Foundation is so huge and broad. It includes people from, West Africa, people from East Africa, people from Zimbabwe, people from Australia. And the team specifically focusing on digital health, health, informatics. Yeah. So today, we are not going to be talking really about other things like a workforce development or partnerships that Vaka has established or preventive health. We will just be focusing on entrepreneurship. And under the entrepreneurship arm, which is led by adjunct Professor Peter Williams, Vaka Health Foundation has set up what it calls a Startup Accelerator program. This program was informed by a program which Peter did at the end of last year when he went around several countries within the Hexagon region and interacted with nurses. It was realized that there was need to open up a platform where nurses can actually interact with other people in the community to solve real problems. So we are not expecting that, within the Startup Accelerator program, we are just dealing with nurses. So you may have found that I was, keeping referring to nurses when I started, but this Startup Accelerator program is for everyone, but it's centered around health, which is why you keep hearing the subject of nurses, propping up. This is an elite startup empowerment program backed by the creation of what we call X Markets, which is an online marketplace, which is something that we are establishing in Zimbabwe and other countries, in the Hexagon region. It finds promising ideas and supports with resources for ideation to actual execution of the strategies. It supports with seed funding. It facilitates cross-border exchange within the Hexagon region and cross-pollination of ideas, even, with other entrepreneurs in the developed world. It facilitates twinning with entrepreneurs in the diaspora who may be wishing to invest in Africa. So if you are going to get anything from this meeting, let it be this slide. This is the heart of the Startup Accelerator program. It wants to identify promising ideas, support with resources for ideation and execution. It wants to support with seed funding. It wants to facilitate cross-border exchange of ideas, cross-pollination of ideas. It wants to facilitate twinning with the entrepreneurs in the diaspora. How is that going to happen? It starts from the mission. Again, the mission is to improve health outcomes across Africa. If we address food issues, if we address education issues, if we address access to healthcare, access to energy, access to water, if we address poverty, then we can improve health outcomes holistically, because these things that I'm identifying as focus areas are known as the social determinants of health. These are the causes of the causes. When we have poverty, when you have poor, quality of water, you can have typhoid, you can have cholera. So the disease itself, cholera, is not the problem. The problem is what is causing that, which is the social determinant of health. So the Startup Accelerator program builds on ideas which are addressing the social determinants of health. This is why we want to have engineers involved. This is why we want to have, other practitioners, accountants involved. We want to have, like manufacturers involved, because ultimately, if we have them and we build, their ideas together with healthcare workers, we are going to address the causes of the causes. So, who is eligible for funding? Who is eligible to participate in the Vaka Startup Accelerator program? You have an idea which is under ideation, or an idea which has actually been implemented in the last 2 years. You are still starting up and it can be accelerated. But this is not cast in stone. You may have a good idea which started more than four years ago, but it just needs, seed funding for it to, extend. You are still welcome to apply, for this funding. So don't, back off. If your program has been there for 2 years, the idea is really, does it identify with Vaka's mission, which is improving health outcomes? So if you are making, cheaper clothes, that's some form of innovation. Innovation is not just a new idea. You may be making clothes, but the technology that you are using makes it possible that your clothes are high quality and are cheaper, which means people will save money, which they can use to buy more food, to buy medicines. So you identify with the Vaka mission, you identify with the Vaka vision. So you are welcome to apply. We are interested in ideas which leverage technology. Why? Because technology, facilitates operational efficiency. So we are interested in those ideas which leverage, technology. We are also interested in ideas which are involving young men, women, and health workers. So you can be a young man, you can be a young woman, or you can be a health worker, no age limitation. This is, when the board is reviewing these ideas, they will look at some of those aspects, but these are not really cast in stone. So don't back off even, if you are no longer a young man or you are no longer a young, woman, or if you are not a health worker, like I said. But it may be that in your team, you find, or you have a health worker, that will increase weight, in terms of how people are going to review, your application. So try to engage and be able to be involved, with health workers. Um, you are supposed to submit, how do you apply? You are supposed to submit a one-pager concept note, which really just outlines, your concept. And then associated with that, you also submit a 10-slide pitch deck. I'm going to really, describe what a pitch deck is all about and what we expect to find in the pitch deck. The deadline for application is 30 September. So 24 days, from now, you need to have done your one pager. You need to have submitted your, slide deck. I will share the link where you, submit, but you can also find, the link in our startup call, which we shared along with the meeting invitation. So what is going to be on your concept notes, and what is really going to be on your pitch deck? So within your concept notes, what we expect to find is that you will, name your project or your startup. You are going to identify the problem that you are solving. You are going to also outline the solution that you are, prescribing. You have an execution plan, a summary of that, which is really your goals, your targets, your strategies. You also include a budget and a timeline for your vision or for your plan. And then you also share information about your team members and their skills. And this is very important to do so. So that, the capacity to implement can also be, weighted alongside the strength of your team members. So this is really it, in your 10 page, in your 10 slide pitch deck. And then the concept note is just a summary of all these things. You don't really need to crack your head, to say, what are you going to write? It's really summarizing what is in the pitch deck. That's your concept note. And then the pitch deck itself is the 10 slides, guided by these slides. Then, what is going to happen next after you have applied? So after you have applied, there's going to be a 9-day period where these submissions are going to be evaluated by a team from Vaka Health Foundation. Then the shortlisted projects for this year are going to then be notified, and then they will start receiving support to actually further develop their ideas. So we'll be conducting weekly webinars from October 9, where we will be supporting the shortlisted projects with things like value proposition, doing your business canvas model, and preparing your final pitch deck, which is going to be done at an in-person conference, which is happening either mid-November up to mid-December. So for this call, only 4 countries are eligible, and that is Zimbabwe, Tanzania, Uganda, and Botswana. So if you are from a country which is outside these, 4 countries, you need to wait for the next call, which is going to happen around March, April for other countries. So from Tanzania, from Uganda, from Botswana, you are going to be part of the first cohort of the Startup Accelerator program. So, and then there will be in-person pitch conferences for the shortlisted products, which are happening mid-December, mid-November to mid-December. At these in-person pitch conferences, this is where you are going to meet the Vaka team, discuss execution plan, and actually start, discussing around the actual funding that you will receive, and how you will receive it, and what then happens next. So this is really it, ladies and gentlemen. The Vaka Health Startup Accelerator Program is meant, for ideas which are aligned with the Vaka vision, which is lifting the health outcomes. It centers around working with health workers, or even, I mean, you can be a non-health worker, but with an idea that aligns with the vision. You are required to come up with a concept note. You are required to also come up with a pitch deck. The application details are in the code that we have sent. If you have not received, I mean, the links, you can email us at vakahealthfoundation.org. So take note of that to be able, and then kindly omit this last full stop here. The email address ends at org. So vakahealthfoundation.org. You can write that down, send us an email. Our team members will get back to you with the, concept notes as well as the application links, and you can work on your concept notes, you can work on your pitch deck, and then you can upload. Then these are going to be evaluated between 1 and 3 weeks, and you will be notified if your idea is qualified for the in-person conferences, which are happening mid-November to mid-December. So I will now pause, this presentation and come back, to the meeting. And there are, very few of us here, so I can take questions from everyone. Just probably raise your hand for this to be ordered, and then you can, I can allow you to ask a question, and then we can take it like that. Rowan Meda, you can go on first.
Uh, Thank you, Mr. Jopiro. I'm Rowan Meda, founder of Mutenga Bamboo. Can you hear me?
Yes, I can hear
Hello.
you. I can hear you, Rowan. Go ahead.
All right. Thank you for the presentation. From what I heard, probably this is going to be the, if I'm going to join, it will be the fourth. But from the previous accelerator programs which I've joined, I've seen you've left out what is in for us as a, for me as an entrepreneur, or for us as a team. Because we're supposed to like to tell us what are the benefits, not just from what are we going to benefit, even in monetary terms. We are supposed to know, because if I join you, it means I'm going to invest my time. I'm going to invest my resources to be available in each and every meeting. So we need to know before we apply, because we cannot apply without knowing what's in it for us. Also, you said we start from the 9th of October. Until when? Because I never heard the end of the program. When is the end of the program? Thank you so much.
Thank you very much, Rowan, for those questions. I'm not really sure, if you were in the meeting when I started, but I think one of the slides that I presented, Rowan, specifically, I can try to, put it up again so that, you are clear about what is in it, for this, for you as an entrepreneur. So let me just go back to this slide, which I said that if you are going to get anything from this meeting, I want you to get this slide. This Startup Accelerator program is an elite startup empowerment backed, by creation of, online markets, which we are calling X Marketplace. So if you make it, with your idea to the pitch conference in December, and your idea is, supported with seed funding, you are going to automatically, be able to, be listed on the online marketplace, and you can sell your products. So I cannot specifically say, how much seed funding you are going to get, Rowan, because I do not know, what idea you are pitching and how much funding you need. But this is what we are going to work together when your idea is shortlisted and you are now attending the weekly webinars from 9 October. And I said the in-person conferences, the pitch conferences start from mid-November to mid-December. So I don't know if that is clear, Rowan, but we have a clear roadmap of what we want to do and the time when we want to do that. So I just want to check with you if this is clear, what I have explained, Rowan.
Thank you. I would say somehow. It's not to my satisfactory. I expected numbers and the chances of qualification. Because if it's seed funding, you can say we have got a range from 25, 2,000 up to 100,000 or up to 1 million. Also, right? About on the time frame, okay, I'm satisfied from mid October to mid December, if I'm correct.
Yes, you are very correct, Roy. So
Yeah.
I mean, I will not be able to, give you an indication in terms of numbers, and that is for a very good reason. The way we are working and the partners, that we are working with in Australia, like at the Global Impact Initiative, there is no restriction in terms of how much funding you can get. Your idea is the limitation, and your team, in terms of, their capacity to implement the budget you present, is the limitation. So feel free, Rowan, to propose what is, in relation with your idea and what you are pitching. Don't work with any limitation. That's the advice that I can give.
Thank you so much, Mr. Yugre.
Okay,
Okay,
thanks.
the question.
Uh, okay, Judith, your hand is up. You can go ahead.
Hi, how are you? Thank you for the presentation. I just wanted you to kindly go to the slide where you are showing the elements of the pitch deck, the important
That's okay.
element. Yeah, thank you.
That's okay, Judith. So the elements of the pitch deck, and you can get a screenshot. This is the slide, but you can also send us an email. And I can share with you, even the presentation as well, if you want it. But after this, we are also going to put up this presentation on our YouTube channel, so you can always come back to it, and you can be able to refer to these things, Judith.
Thank you.
All right. Is there someone else with a question? I don't see any other hands. So can I assume that we are good men? You can go ahead. Good men, you can unmute yourself, and then
Okay.
thank you.
Okay, thank you. How many members should be in a team? That team that should encompass young men and nurses so.
All right. So I don't have a specific number again. Good men. Really, what we are looking for is an objective. Plan an objective project. You're identifying a solution that you are solving. So this really should be guiding you, as an individual in terms of the team members that you want. So the guidance in terms of, what people prefer to see in terms of young men, young women, or health workers is really, any funder has a particular preference. So this is general guidance. But you can be a one-man band and you have a brilliant idea and you can show that you can implement it. You are still going to qualify good men. So don't be limited or be restricted by wanting to, say I have a big team or I have a small team and everything else. That is really, not so important. I don't know if this is helpful, but I'm being objective in terms of, how I'm answering this.
Thank you very much. I've understood.
Okay, then. Then another issue is also if you feel you want to be able to get more information as an individual, you can also send us an email and we can arrange, a short 10 to 15-minute meeting to just address your specific concern. You may be worried to do it, in the presence of others. So feel free to also approach us through email and one of our team members will, come back to you. Tawana Kambarami and then Rowan after that. Tawana first.
Okay. Thank you for the presentation. My question is related to security. What if I pitch and then my idea goes on to be used by someone? How do you deal with such a situation?
So for those situations, you are going to, we are going to sign a non-disclosure, agreement with you, for you to be able to, if your project is shortlisted and we proceed to work with you. So it's really a bit complex to sign, the non-disclosure agreement at this point, because we don't know who is going to apply or not apply. But once your project has been shortlisted, the security around that is that we will only proceed to work with you and start, coaching, working with our teams and stuff once a non-disclosure agreement has been signed by both parties. And the terms and conditions in those agreements, something that you will be comfortable with. So this is what I can say, Tawana. But you may still be worried that I want to pitch, but I can't sign, before I pitch. It's really also complex for us in terms of how we can, sign before, you have applied or we know who wants to apply. So that, that was a bit, complex for us to manage that point. But before we go for the ideation coaching and then the in-person conferences, all the ideas that are shortlisted are going to have non-disclosure, documents signed, Tawan.
No, it's fine. Thank you.
Rowan, you are next.
My name.
You're on mute, Rowan. Can you unmute so that I can hear you, Rowan?
Hello.
Yes, I can hear you now.
It's a request. Can I have a copy of this pitch deck in my email? Is it possible?
Yes. So if you send us an email to vakaafire@vakahealthfoundation.org, I will reply, or one of my team members will reply and send you the pitch deck. So the slide deck, not the pitch deck. Yes.
The slide. Yes, yes, yes. All right. Thank you.
Thanks, Rowan. Any other questions? I don't see any new hands. Judith, you can go again.
I just wanted to know the team members, do they have to be limited to, I mean, I'm from Uganda. Do they have to be limited to Ugandans?
No. Like,
Okay, just in case
we
I'm collaborating with an international university, they're interested, but not
that,
exactly accessible to funding. Yeah.
yes, Judith. So remember, let me just go to the slides.
Okay.
Let me just go to the slides. So this is the slide that I'm talking about, Judith. One of our goals is to actually facilitate cross-border exchange within the region and beyond, like through twinning with entrepreneurs in the diaspora. So don't be restricted by geography or any boundaries. Your idea, it's really about having ideas which solve Africa's problems. So this is where, you should sweat it out. But in terms of who you are working with and everything else, we understand that business, should not be restricted by geography. So we are actually also trying to use this program to, facilitate those exchanges. And you may find that, ideas involving that arrangement may actually, be favored by the funders when, they see such collaborations. So Judith, I want to emphasize, don't be restricted by geography.
Thank you.
All right. I don't see any other hands. I will now just emphasize that we want to hear from you. If you are not certain about anything, even before you, upload your idea, feel free to use our email. Our team members will be working to respond to you, and we can pick it up from there. So this recording is going to be on our YouTube channel. If you search at Vaka Health Foundation on YouTube, you are going to be finding this recording from tomorrow. You can reflect to it. But if you want, the slide deck like Rowan, send in an email. We will, try to respond by tomorrow again and get the slide deck through to you, because we know the dates are close by. And if you want any further help, feel free to use our emails. So I will say we can get the next 25 minutes back, because it was a few of us here, so we didn't have many questions. But let's engage. I look forward, to really working with you all and our team members as we take this idea forward So thank you very much. Have a good day. Rowan, I appreciate the message you have sent in the chat. I'm not saying everyone else sent messages in the chat, but I mean, I just saw the message pop up. So have a good afternoon. I mean, it was a pleasure to see you, Alice, Priska, Harriet. We have met before, but it was good to see you again, and many other new people that I saw, Gina, Tawana, Rowan. It was really a pleasure. Have a good afternoon, guys. Goodbye.
Bye-bye.